Morning, everybody. Welcome back. Here we are, Friday, April 10th, 2020. And I think this is our fourth week of being with you guys during this coronavirus situation. And I hope that everyone's doing okay out there. Hope that everyone's staying healthy. If you have had coronavirus personally or in your family, I hope everyone is recovering. And, we continue to see ongoing increases of cases, ongoing increases of health issues, and also deaths, particularly here in the U.S. And it's pretty amazing to me, really, that the United States as a country is continuing to really struggle with how to handle this epidemic and pandemic. And there are certainly some bright spots, and some states are doing better than others. But really, we still have a long way to go. And I think we're all feeling that, being, cautious and careful, and also being home and sheltered in place. It's definitely intense. It's taking a toll. So as always, our goal today is to bring you some good information. And we'll have a medical update with Dr. Ramsey Asfour and myself. We'll have some time for question and answer, and from there we'll shift to Lindsay Christensen, who's here again with us today to provide some nutrition and dietary support information. And then Valerie will lead some stress management, mindfulness exercises, quick tips, things that we can all do on a regular basis to support ourselves, to support our immune system, to decrease stress, and to weather this situation as best possible. And we will break out into breakout rooms as we have before. And let us know going forward how helpful that you find that opportunity to talk in a smaller group setting. And that's important to us to kind of understand how to best serve you. So everyone, as you're joining, also please make sure that you mute yourself, and we'll use the chat box for Q&A questions. Okay, so with that, Ramsey, Dr. Ramsey Asfour, if you want to take over, and we'll go from there.
Got it. Christy, can you enable me to share my screen? It was apparently disabled. So in the meantime, while that's getting done, we will just give you guys a brief update on what's been going on and the major events of the week. So COVID has been expanding in the country, as you know, and I'll show you some slides in a minute about that. But the major issue is increasing number of cases in some areas. But there's some good news here that a lot of our early interventions, especially in California, have and on the West Coast in particular, have really made it so that we can minimize the impact on hospital resources, and I'll show you that in a second. So here's our total confirmed cases worldwide is 1.6 million now. The U.S. is leading the pack, unfortunately, as we can see. And remember, you can zoom in on this map, which is kind of handy if you're really interested in focusing in. This goes down to the county level. And one thing just to show you all is that a lot of these states have small little counties that aren't so affected, although there are some cases in some of the rural counties in the United States. That's actually where a lot of our excess bed capacity is. If you look at California at the county level, it doesn't look so bad. Some counties, like Lake County, only have 3 cases so far. So a lot of our rural areas are far behind. The metropolitan areas, as where we have travel, is where a lot of this has been happening. And this is just another website from Definitive Healthcare showing, where the outbreak has been more severe and in which hospitals. And you can tell, if you look at it this way, it looks pretty impressive. But then these are all the beds uh, hospitals in different areas. And if you look, we have a total of 945,000. It's almost a million beds. 810 of those are staffed. And so our average bed utilization rate across the country is less than 50%. So we have capacity, to take care of these patients across the country. So that's some good news right there. This is a site from the University of Washington, and they talk about projections of COVID, and you can look at different parts. And this is really interesting. You can look at this by resource. So all beds. So New York is, and this purple shading is the confidence interval. So this is a statistical sample or statistical estimate where we hopefully we're in the median here on the middle or lower, but we've possibly planning on being above capacity in some places and below capacity in others. So we do need 16,000 ventilators. Apparently, they're estimating there might be a total bed shortage across the country, but I don't think that's actually going to pass if you look at the country as a whole. But if you look at you can look at different countries here. It's fascinating. You can look at California, for example. So stay-at-home order was on March 19th. Educational facilities closed. So we were one of the earlier states in California to make this change. And if you look at all beds, and this is the bed capacity up here, we are not experiencing any shortage, and we are not projected. Even if you look at intensive care unit capacity here, even at the worst case scenario on this estimate, we're likely not to exceed ICU bed capacity. And in fact, a lot of hospitals, despite what you might be hearing, a lot of hospitals in California are significantly under capacity and actually losing money because they rely on elective procedures to stay in business. So if you look at ventilators again, we're not projected to exceed our capacity, but we might, but that might change. Again, that's California. And just to compare it to the situation in New York really quickly, you can see that if you look at all resources in New York, it's easier to look at one at a time, actually, beds. So again, we're going to exceed the bed capacity in New York. And in fact, we're hoping that it peaked 2 days ago. And they're slightly behind California in terms of closing facilities, which might in part explain the epidemic in New York, as well as lots of travel from Europe, importing a lot of cases to New York. So not travel from China, but it was likely travel from Europe that was the culprit in this case. So this is also a very interesting graph from Johns Hopkins Coronavirus Research Center to show who's flattening the curve. And this is the United States. It looks like we are indeed flattening the curve. You can certainly zoom in a little bit here to find out more details. I'll spare you a lot of those, but even places like Italy, it looks like the curve is flattening. France had a spike earlier. We were worried that the curve was trending up, but now it seems to be going down. The UK, as you all know, Boris Johnson, the Prime Minister, also was in the ICU, and I think now he's out. And other places, including Iran, seem to be flattening the curve. So a little bit of fact-checking and debunking myths. This is from the Seattle Times, but there's a lot of myths here. I'll give you my interpretation as well. Young people are not susceptible to the virus, and that's definitely a myth. Anybody can be infected, and certainly we're learning that people with asthma or other chronic medical conditions can be at slightly higher risk, which is a concern. So the logic that I should just get the infection and get it over with is really not as clean as some people are thinking. And one of the factors here is the burden of infectivity, how much you've been exposed. So we've seen some young doctors, young healthcare workers die, and that might be because they were exposed to a large burden of virus. Another myth, the coronavirus can't survive airborne or on surfaces. So we're learning that there is, in some cases, some hanging out of the virus in the air in some situations, a closed room. So ventilation is much better, and staying 6 feet apart in the ventilated room. Somebody's asking a question recommending 13 feet apart. You know, keep that in mind, that yeah, if the room has ventilation, you could probably be a little bit closer. So that's a very important consideration. A myth we're learning, and there's been some recommendations this week or guidance saying that we're not going to see a major dip in the summer, which is certainly unfortunate. But you know, we've had influenza pandemics start in the summer in history, so we know that that can happen. Probably there'll be slightly less person-to-person transmission, and certainly less transmission outside would be likely as the droplets dry up in warmer weather. So we expect a little bit less transmission outside, but we're not expecting a major dip in the summer, which is unfortunate. Taking a hot bath prevents you from getting infected with the virus. Well, that's actually not true. And you don't necessarily significantly increase your body temperature that way. There is some data in studying Finns versus other Scandinavians. Finns are known for lots of saunas, but they do hot, cold saunas. That's probably good for the immune system overall. And also the Wim Hof method it is thought to be good for the immune system overall, but will it specifically help in coronavirus? Probably not. A myth, face masks don't work to prevent infection. Well, they actually do. So face masks are very useful. And if everybody's wearing a face mask, and I strongly urge you all to put peer pressure on people you see not wearing a face mask, then everybody will be protected. So I'm working with a couple of agencies on a plan to reopen up businesses and how we can do that safely. So, and somebody said, well, what if people who've been infected, maybe they don't have to wear a mask? I said, no. For example, everybody on public transportation, when everything starts to open up again, should be wearing a mask, because you don't know if that person has been infected or not, unless you're wearing a badge that says I'm immune. And so that I think masking will, if you're sick and shedding virus, or if you're before you're sick and shedding, and you still might be shedding virus, wearing a mask is helpful. It's preventative. And I think we all, even if you're not sick, that can be helped. So keep that in mind. Another myth, covering your body with chlorine or alcohol, well, that's unhealthy. It ruins your microbiome. In my opinion, it'll probably make you more susceptible to infection. Rinsing your nose with normal saline, that's also not true. You're probably disrupting your microbiome. Eating garlic protects you against the coronavirus. Well, garlic has some antimicrobial properties, but there's no evidence to suggest that that will work. Hand dryers do not kill the virus. And we're all talking about ibuprofen might worsen symptoms. That's very controversial. We don't know for sure, but our advice is use acetaminophen instead of ibuprofen if you really need to. But again, don't treat a fever at this time unnecessarily. Something else that, let's keep in mind that it may not feel like it now. This is from the New York Times. But out of this crisis, there's a chance to build a better America. So there's a lot of positive things to take home. Keep that in mind. A lot going on, and having a background in public health myself, having worked at the World Health Organization, I'm really keen on supporting our public health infrastructure. I think that's one of the major problems, that we haven't had good support for public health. Public health is something you pay money to, and then you never see, if you're lucky, you'll never see them in action. But your tax dollars are going to support them. And now we know we should have been paying them more. So support, pressure your politicians to support your public health infrastructure. The CDC on their website has a symptom screener now, a self-checker. So if you're wondering if you might have coronavirus, this is a useful tool to take a look at. A lot of people are talking about antibodies. And so one of the treatment modalities might be using antibodies in recovered patients' blood and infusing them in people who are sick. That's ongoing. We'll have more data. That was used for Ebola. Should I wear gloves? A lot of people ask, in addition to face coverings. The short answer is no. The virus will last longer on your gloves than it will on your skin. So depending what you're doing, obviously if you're a healthcare worker seeing a patient, then yes, wearing gloves. But if you're in a grocery store wearing gloves, then you're going to keep that virus on the gloves longer than it would stay on your hand. And you'd be more likely to infect yourself if you touched your face, for example. In the nursing homes, as many of you know, I do a lot of support for infection prevention, also in nursing homes. So there's been some outbreaks, and I think that's one of the major weaknesses in our healthcare system. We have a lot of older people who are susceptible, living very close together. There's been many outbreaks in nursing homes in California now and across the nation. So we're keeping an eye on that. That's the weakness in the Bay Area and lots of places, for that if those nursing home patients get really sick, they're going to overwhelm the capacity in the hospitals. So that's where bed capacity regionally needs to be considered and distributed, but also maybe even beyond local regions into places that have capacity, like in rural hospitals. So antibody tests are becoming more widely available to the general public. Stanford and also in LA County are conducting tests. And the Stanford results should be out early next week to know who may have had coronavirus already and without knowing it. There is some talk about coronavirus COVID circulating late in 2019 in the US, and so we have yet to see hard data supporting that, but there's a lot of hypotheses. It's certainly conceivable. The thing for me that argues against that is that we should have seen more outbreaks, major outbreaks in nursing homes, and we haven't seen that. So we didn't see that till what happened at the Life Care Center in Washington State near Seattle. So Stanford is testing healthcare workers. This is key. I think healthcare workers need to have antibody tests to know if they've been infected, and Stanford has started doing that. And so this test is not yet widely available, but it will be soon. And we will be offering that test as soon as we can safely, and certainly when LabCorp and Quest are up to speed on their ability to do that test. So keep in mind that there's a lot going on about all of these treatments and should I do this or take that? Some treatments may be harmful, some treatments may be helpful. Even though something works in the lab, doesn't necessarily mean it's going to work in you. So this is Dr. Khalil. He's at the University of Nebraska Medical Center, infectious disease physician. That's, as you might know, the biocontainment unit. That's where the Ebola patients were transferred when we had the Ebola issue. And they've been dealing with this from day one in this country. So he's really recommending not to think that, hey, just because hydroxychloroquine works in vitro, or there's some preliminary data, we don't know if that's going to really work well. So again, it goes back to staying healthy, keeping balance in your nervous system. But with that caveat that we don't know if things are going to work, just to show you, ivermectin, which is another antiparasitic, can inhibit the replication of SARS-CoV-2, which is the name of the virus that causes COVID, which is the clinical disease, might work. So there's some more emerging data. Again, it needs to be studied in clinical trials. And just to end with a handshake, this is Trump shaking hands with somebody else, I forgot his name right now, with John Mascola, director of the Vaccine Center. But this is Dr. Fauci here sitting back and saying, I'm not shaking hands, don't shake hands. So if we take one thing from this, it's, the Asian societies have a much better way of greeting they don't shake hands, and fist bump, elbow bump, something like that. Let's change the way we do that. That will, in the future, decrease rates of flu and other things. There's a lot of pressure to shake hands because that's what we do societally. Dr. Schweig, I'll leave it to you to show a few slides, and then we'll answer some questions.
Great, thank you so much, Ramsey. That was very helpful. So I'm just going to do a little slide presentation again. Okay, so one sec. So I kind of am a little bit of a nerd when it comes to visualizations on health and scientific, art. This is a really nice piece of work that was put together by a woman named Avestra Rastan, and you can see her information there at the top, her website, etc. But just kind of gives us a sense of what's happening. And if this is interesting to you, if you like to kind of learn about this stuff, great. If you find it scary or overwhelming, then maybe avoid it. But for those of us who want to learn a little bit more of the underlying pathophysiology, I think this can be helpful. But again, the same global recommendations that we've all been talking about: social distancing, trying our best to stay healthy and maintain our immune system, staying informed. We're trying to provide some of that for everybody in this context, but also, balanced and judicious, reviewing of the literature, the news, information that's out there, tracking what's going on. And then, I think Ramsey brought up a great point in terms of, you know, we need to support the organizations who are going to help us through these kinds of pandemics. And the WHO is one. There's some controversy there in terms of how well they've handled the situation. Overall, a very, very important organization. And then our own public health infrastructure and our own government infrastructure. And I think it's pretty tragic to me what's happening in the US, that we're really leading the charge on how not to do this. And we're pretty much on the exact opposite end of the spectrum of what kind of example you want to be showing. And I think there's a lot of different factors, right? And so we need to be prioritizing these issues. We need to be prioritizing science. We need to be prioritizing the organizations who can help us get through this. And then, of course, just the basic societal and community organizations that are going to help those who are, are affected in a disparate way, and they're really seeing a skew happening where African American, Hispanic, lower socioeconomic status people are disproportionately affected. And so I feel extremely lucky. We have resources, we have food. I have a job which I can pivot to doing online. And there's so many people out there who are struggling from a societal level, but also from a health point of view, because it's putting them at greater health risk. And so we need to be really cognizant of that as well. This is another really nice YouTube video for just understanding the whole background on where this came from, how it evolved, what happens in our body. This is sort of more on the med students. This is a website called Ninja Nerds, and they basically put together a number of different, videos where this gentleman talks through everything involved while he's drawing it out and showing you the visual. And so I'm both an audio learner and kinesthetic, so you get some of that sense of like the movement of the information, which can be really helpful for understanding. So pretty highly recommended here. This is a great short 20 to 30-minute video. Ramsey touched on this, Dr. Osfer touched on this, the question of, is there some degree of herd immunity in California? And I agree, Ramsey, I don't really think that there is. There was a lot of influenza A, influenza B coming through early, in the season, fall, winter, which could have been causing symptoms in folks. And as with any, I think really again, gratitude. I think California really is leading the charge in a lot of ways in terms of how aggressively we jumped on things, how quickly, our government officials were able to recommend sheltering in place and shutting down of activity and business, et cetera. I think that's a lot of what's helping us in California. So really important work there. Some people wonder if there, is a little bit of a political slant in some of these stories because, the theories of is there a herd immunity in California were quickly picked up and amplified in a lot of conservative news channels and news forces, especially, talk show leaders, for example, Rush Limbaugh. And the question is, are they trying to basically take away attention from the important work that our government here in California has done and maybe attribute those benefits to some other forces? So again, anything you read, be careful of some of the underlying currents at work. There's also a question out there of, should I get infected, particularly if I'm at lower risk in order to generate immunity? Please don't. Please be cognizant this is a pretty bad idea. There's a number of different reasons. And I highly doubt that many of you are thinking about this, but it's important to understand that there is some, different pockets of discussion on this. Immunity is not a sure thing. You could get reinfected. The virus can live inside of you. Even young people, as Dr. Asfor mentioned, can get quite sick and be hospitalized. There's a risk of long-term damage with this illness, and a mild case could be severe. And again, there's really not a shortcut to immunity. So what we're doing right now is, I think, the most important step. We're certainly not solving the problem. There's going to be waves, as we've talked about. There's going to be lots of discussion and how do we reintegrate people back into society. And a lot of European countries are talking about using a certificate of immunity once you are tested and you show that you have high antibody titers, that those people are going to be prioritized to re-enter work and society, et cetera. It's also really important for me to have everyone be aware that, coronavirus is not the only thing happening out there. There's concern for other health issues, other, issues that disproportionately affect our patient population. For example, Lyme disease. And this was an article in Forbes that came out last week, editorial. And, ticks are out there in force. We've been, again, have the lucky circumstance of living in a part of Marin County where we have easy access to trails. And so right from our house, we can walk out into the hills and get some exercise. In one 5-foot span yesterday when I was hiking with my wife and daughter, in one 5-foot span, we saw 50 ticks, 50 ticks. And, so scary, concerning, get out there if you feel comfortable. I still recommend outdoor activity. But as always, when you come home, take your clothes off, leave them outside, put them in the hot dryer for 20 minutes, take a quick shower, and check yourself and your partner for ticks. And do so with the understanding that some of those ticks are really visible, and some are literally the size of a poppy seed or the period at the end of the sentence, and it might just look like a speck of dust. And so use a magnifying glass. We have several in our house. Your smartphone, there's magnification features on there. It's quite effective. You can take, get a close up and see. But ticks haven't heard about the coronavirus. They don't stay home. They don't really know anything about social distancing, and they're definitely not taking the spring off. So please be aware. Couple of updates on treatments. There was a study that came out of France a few weeks back. It's hard to imagine that was only a few weeks. That feels like a lifetime ago, given everything we're living through. But looking at hydroxychloroquine, and unfortunately, that there was some concerns at the time, and more recently, that paper has been retracted. And so there's still evolving discussion on what are these medications doing. Dr. Asfor mentioned ivermectin that's come up in the news. I have heard stories of people getting treated, and it's seeming like hydroxychloroquine in particular has been helpful. So I'm not saying it's not, but I'm just saying that the research hasn't caught up with us, and it's still very much an evolving area. And as we talked in the last couple of weeks, the science is moving very, very fast. And so there's going to be sort of, 2 steps forward, 1 step back on a lot of these things as we figure out what the long term looks like. This was a nice study that came out, just in March 18th. It was published, and looking at convalescent plasma therapy in severe COVID-19 patients. This is basically where somebody um, gets sick, they're taken to the hospital setting, and then they are treated with plasma that was drawn off of another patient who had been sick and recovered. And so this basically has antibodies against the coronavirus, and they're basically infusing some of those antibodies in the plasma. And 10 patients in this study, but they did show some really interesting improvements in these patients, including on oxygen levels, on inflammation markers, CRP, et cetera. So definitely an early area of promise in the research. This study in particular was, I just noticed, actually I hadn't noticed it before, but one of the reviewers was Ian Lipkin, who's a highly respected researcher. So I think this is pretty good science. On the lighter side, we're all living on Zoom as we are today. So get creative, pick your favorite background. You can do virtual backgrounds in Zoom. This is a friend and colleague of mine, Daniel Kraft, who's a healthcare innovator, and he chose to have the Brady Bunch on the background there. Many of us celebrated Passover this week. It's just particularly poignant, the Passover Seder on Zoom. Why is this night different from all the other nights? I think we have a little extra meaning going on there. And to end, a little picture from a hospital in Hong Kong. Cute little babies wrapped up and protected. So I will pause there, and we can jump into questions. And one thing I want to ask you, Ramsey, and jump into first is a lot of question on social distancing. How far? When you're out hiking, if you're out walking, what is the distance? We've been told 6 feet. That's a big number in the news, and there's more concern now about there's a growing discussion, I think, building on, is 6 feet enough? Should it be something more like 13 feet? And also, what are the risk or possibility that the coronavirus can be transmitted or passed just by breathing, just by exhaling, absent a cough or a sneeze, or obviously, respiratory droplet exposure. What are your thoughts on that?
I think that's a good question. I think outdoors, the risk is lower than indoors. It's about ventilation too. So, and air exchanges. So on a windy day, I was hiking with my family last Sunday, and it was a really wide trail, but people were going up into the bushes and to avoid us completely, and instead of walking within 2 feet of us to crisscross. And I was thinking, they have a much higher risk of Lyme disease up there in the bush than getting sick from coronavirus. We were not masked on hiking, which is something you can do if you're one of the more susceptible people. It was a strenuous hike, and we were breathing heavy. So sure, it's not a zero risk situation, but it's a very low risk situation, especially if there's a breeze. You're walking past somebody. Unless they generate a lot of droplets by coughing, I know they might be breathing heavily if they're jogging past you. So there's probably some risk there, to be honest, but that risk is low, and so we have to take a risk mitigation strategy. You probably need a certain inoculum of the virus to get infected as well. You need X number of particles. So if you have just a tiny number of particles, you probably won't get infected. And plus, your breath, inhale, or touching your face has to be timed exactly. So there's a lot of factors that play a role. So I wouldn't necessarily think that that's high risk. So if you're on a narrow, crowded trail that there's lots of people, and you can't go as fast as you'd like to go because there's people in front, people in back, people passing you, that's higher risk. But the occasional passerby, I don't think that's I don't think that's a major concern.
Yeah, one thing that we were doing, we brought masks with us on our hike and didn't wear them when we were just by ourselves. But if we were passing somebody in close proximity, and again, we're not going to be ones to jump off into the grasses for the reasons we've talked about. So I would just put on my mask when I pass people, and
Yeah, that's a reasonable approach, especially on a trail that's not that crowded. Fire roads are,
easier. Yeah,
safer, easier, they're wider. So those are trails you might favor if you're a higher risk person, especially.
yeah,
So
great.
uh,
So let's look at our question
there's a lot
box.
of questions about Curcumin. We don't know, to be honest, if is Curcumin safe. It's probably safe. If it's doing you some long-term good for other reasons, take it. If you need it for pain, a little bit of inflammation, take it. If you don't need it and you're taking it just to protect you from coronavirus, don't take it. I mean, I think it's, if the medication you're taking is helping you for reasons, or supplement you're taking is helping you for certain reasons, don't stop it. We don't have the science, but don't take extra to prevent coronavirus without really knowing uh, what's going on. Somebody also asked what's our take on people who have lost their jobs and healthcare, stay safe. So I'm working on with a group trying to, and we'll rally and we'll announce. We're working on a petition. We want to work with. I have a lot of contacts with county and state health officials, and we want to work with them to help, open up businesses. And one idea is a staged approach, where, for example, corporate offices can open with 1/4 of their normal staffing, so that they can maintain distance, they can mask, and you can start reopening businesses and factories on a staggered, staged level. So that's being planned already. So a lot of us are working on some ideas around there. Uh, Somebody's asking if the virus is actually harming the hemoglobin. So that's an interesting question. And there is some thought that that's perhaps one of the mechanisms of injury, but there's some complicated medical issues around that. And you would expect the oxygen saturation, that thing that you clamp on the finger, to decrease if that were the case. And the blood gas level of oxygen, we call that the partial pressure of oxygen in the blood on a blood gas test, which is you take blood from the artery and you measure it in an analyzer. We'd expect there to be a significant discordance between the two, and that hasn't been the experience for most of us taking care of these patients. So while there might be some harm, it's probably not sufficient enough to explain the severity of the disease.
What about this evolving discussion on who to put on a ventilator and when? That's an interesting kind of thing that I've been tracking, where traditionally we use the oxygen concentration in the blood, right? You use a little finger probe and you have a metric that shows you the blood oxygen level. And when it drops below 92 or into the high 80s or worse in mid 80s, you are more concerned. But and so that's what we kind of, one of the metrics we use to decide, okay, when do we go from normal hospital care to more of an ICU ventilator setting? But there's also an evolving discussion around, is that the right metric to be using for this illness? And are some people potentially being harmed by put on ventilators and maybe being better off not? What's your view on that at this point?
Well, I mean, that's a great discussion. And in fact, the head of emergency services at Zuckerberg San Francisco General versus the head of the critical care unit there are in disagreement on
Oh,
that
wow.
issue. So my take is that there's a lot of factors, and one of them is that when you intubate somebody, when you put somebody on the ventilator, you're generating some aerosols, but that's transient. Then you're kind of controlling the aerosols. Remember, the aerosols are what really can spread COVID. But the alternative to a ventilator is what we call non-invasive ventilation. And we often, in medicine, we generally move to non-invasive ventilation. We call that BiPAP, or some of you might know what a CPAP machine is. That's for at home. You're using that to blow air into your airways when you sleep, so you to treat sleep apnea. So there's this mask, and there's different kinds of masks, but those actually generate aerosols. And
Because they're
so
blowing
they're
towards you.
exactly. And there's another form of oxygen called high flow oxygen that also generates aerosols. So the non-invasive, so putting somebody on the ventilator that's called with a tube down their trachea, that's considered invasive ventilation. So non-invasive are what we just talked about, the masks and things. Those non-invasive ones generate aerosols, and the invasive ones don't. So for an infection prevention standpoint, we prefer to have somebody on the ventilator than on a aerosol generating BiPAP machine. So the thinking has been to intubate early, to put them on a ventilator early. That's has to be tied with availability of supplies and protection from airborne N95 masks and these devices called PAPRs that are even better than N95s. And then to what actually is happening. Remember, a lot of people who require a ventilator are sick already. So to tease that variable out is very challenging. And so some data in Italy suggests maybe there's some harm in ventilation, but if you do the ventilation properly, there's probably not that much harm. So we use these beds, they're called rotoprone beds when somebody has severe influenza. It's a bed where you can have somebody on the ventilator and you can prone them. Prone them means lay them on their stomach. And in most ICUs, patients are always on their back. It's just easier to manage the patient and the airway. But you can actually, even without a rotoprone bed, where some of the hospitals are doing trainings led by physical therapists to flip people upside down and turn them upside down. And that's probably going to help a lot of people. So you don't need that very expensive bed, of which there aren't that many in the country, to do that. So we'll find out more later. But if somebody needs it right now, it's safer in terms of transmitting to other healthcare workers. And it also depends on the age of the person. If it's an older person, they're likely to do less well, frankly, and may require that ventilator.
Great, thank you. I want to answer a couple of supplement questions. And there's a reference to the work of Chris Masterjohn, who's a PhD. I did list his coronavirus food and supplement guide on our webpage as one of the resources I do recommend. He's a really, really smart guy. Does a lot of research on a number of different topics, vitamin D, calcium, or zinc are a couple of his key areas. And he had been writing a book, but recently completely shut that down and pivoted to coronavirus and spent probably 200 or 300 hours on this topic in the last few weeks. So he has a short guide that you can get on his webpage. He is charging for it. I think it's like $9.99, but I purchased it and I do think it's worthwhile. And then you kind of get access to his updates, etc. He discusses elderberry for one. That was a question. And I do think elderberry can be helpful as an antiviral, supportive, and and it's one of those where it's a quick on, quick off. So if you can take it as a preventive, and then if you do get sick, you can go ahead and stop it if there are any possible concerns that it might upregulate the immune system and potentially worsen or make more severe the secondary phase of the illness, which is the cytokine storm. So that is one that I do still recommend. The propolis was another question. And again, on propolis, it's basically the situation where propolis is an immune booster. It can help the immune system in a variety of capacities, but it can augment the interferon response. And this has been seen for herpes simplex 1 and also in some poultry data with Newcastle disease. So there's some, possibility this can help the immune system on the one hand, but given the fact that this particular virus has that, concerning severe second phase with the upregulation of inflammation, cytokines, et cetera, we're kind of leaning towards not necessarily pushing that side of the immune system too hard to try to avoid that secondary phase of inflammation.
There are some questions more on curcumin. Again, you have to think about inflammation is part of the disease process here, but it's late in the stage. So some anti-inflammatories, like taking steroids early, before when you acquire coronavirus infection, would probably cause some harm, but if you took them later in the course, they might actually be beneficial. So there's a timing factor with all of that. Somebody's asking about elevators. I would say wear a mask, avoid them, minimize the number of people on them, etc. And
Yeah.
I think that's a major.
Touch the buttons with a tissue, or and or just be super aware of your hands. But yeah, that close proximity to people is obviously, you want to be careful.
Right, right, absolutely. Should we take a few more questions, or is it time to?
I think we got through a lot of them. So yeah, I think we're going to go ahead and transition. Just briefly, I want to touch on, so prevention still, I think lungs and herbs herbs and nutrients to support your lungs. So a couple of key ones I'll point out there. This is one of my favorite companies called Natura Health Products. It's a product called Lung and Bronchial Tonic. It's a great general product, but you can also just look this kind of a product up online and see what kind of individual herbs they're using. Things like eclampane, mullein, horehound, lobelia, etc. So there's just a number of nice lung supportive herbs. There's throat coat tea and breathe easy tea. There's different essential oils which are helpful. You can diffuse those. And then the supplement N-acetylcysteine, NAC, is also a nice one for thinning the mucus in the lungs. So it can be used as a nebulizer. That's been hard to find. We've been working hard to track that down at pharmacies. But you can also take it orally, and it has quite good lung and systemic absorption. If you do get sick, things like glutathione, alpha lipoic acid, helpful to support the oxidative stress pathways and the detox pathways in the body. And things like sulforaphane or other ways of helping to turn down the cytokine storm. Those can also be really, really helpful as well. So with that, we'll go ahead and transition over to Lindsay if you want to jump on.
Hey everybody, 1 second, let me share my screen. All right, so this week I wanted to just actually piggyback off of what Dr. Shai was just discussing, sulforaphane. I'm going to talk about some food-based compounds that may help support a healthier inflammatory response in your body, and this there's some interesting connections between inflammation, chronic diseases, and COVID-19. So we're going to talk about some foods today that might help manage inflammation better in your body and help you stay well during this time. So this list is kind of updating constantly, it seems, just kind of looking at the different conditions that seem to either predispose to an increased risk of contracting COVID-19 or to a more severe course of infection. I just got an updated list here. Some of the conditions include cardiovascular disease, type 2 diabetes, obesity, being elderly, smoking, chronic pulmonary disease, liver or kidney disease, and then also recent exposure to chemotherapy treatment or radiation therapy. And a topic that kind of underlies all these conditions is inflammation, the process of inflammation. So it appears that having some underlying inflammation may contribute to a more challenging course of illness with COVID-19, and something we can do, we all have the power to do, is to modify our diet, and that can have a pretty significant impact on nutrition. So I've been doing some more research on the topic of inflammation and how it relates to nutrition and COVID-19. And there's an interesting signaling pathway in the body depicted in this complicated looking picture here, called the NLRP3 inflammasome. And this is a protein complex in your body that actually plays a really important role in helping mount an immune response to pathogens. It's been found to be involved in the inflammatory response to the influenza A virus. And then it's also been implicated in the immune response to SARS-CoV-2, which is the viral cause of COVID-19. So what we do want this inflammatory response to be triggered if we were to be exposed to the virus or get sick. The problem here is that it seems like in the case of COVID, the inflammatory response kind of becomes out of control or hyperactivated. And like Dr. Schwei was talking about, the cytokine storm that can occur kind of towards the end stages of illness is just a really severe inflammatory response that can damage cells and organs, so especially the lungs. So I know it's kind of complicated, but that's just the relationship between this inflammasome and COVID. So in terms of how nutrition ties in here, there's actually a lot of research on the NLRP3 inflammasome and the Western diet, and also foods that can be used to kind of promote a healthier balance of activity in the inflammasome. And one of the main things that upregulates it is eating a Western diet, or otherwise known as the standard American diet. So if you were going to take one step today, which I know I talked about this in previous weeks and probably sound like a broken record, but cutting out processed and refined foods is probably the #1 thing you could do to promote a healthier inflammatory balance in your body, and hopefully boost your defenses and help you stay well. There's also a handful of foods and different food-based compounds, particularly in fruits and vegetables, that modulate this inflammasome. These studies that I've linked to here aren't specifically related to COVID-19, but they're related to modulating this inflammatory activity. So I think I touched on quercetin last week, but this is a polyphenol found in a bunch of fruits and veggies, and it's been found to promote a healthier balance of activity in the inflammasome. And quercetin is found in red onions, apples, capers, and berries. Luteolin is another polyphenol that shows some promise, and it's found in celery, thyme, bell peppers, chamomile, capers, apples, and onions. Green tea is another potentially useful food for modulating this inflammatory activity, particularly because it contains a polyphenol called EGCG. It's an acronym for a longer name that I won't try to pronounce, but it has pretty profound anti-inflammatory activity. And as a side note, there's some very, very pre-clinical research in the form of, they're called molecular docking studies, where scientists are looking at how existing drugs and other natural compounds might interact with SARS-CoV-2 virus. And there's some very preclinical research to suggest that EGCG may interact beneficially in this situation and exert some benefits in the case of this virus. Not saying it's a treatment, but it's just kind of some interesting research. Omega-3 fatty acids are going to be really important as well. So particularly EPA and DHA, which you're going to find almost exclusively in seafood. There's some types of algae-based oils that will contain DHA as well. But these fatty acids have been found to dampen NLRP3 inflammasome activity in cells within the innate immune system. And then finally, vitamin C, found in citrus fruits, pictured here. I forgot to list the other foods, but broccoli and Brussels sprouts are some other good sources. And it also balances inflammatory activity in this particular inflammasome, and it has some other beneficial effects on boosting immune cells and actually protecting the membranes of your immune cells from oxidative stress, which tends to be elevated in infections. A couple more compounds here. Dr. Schweig touched on sulforaphane. I love this molecule, and it really has a bunch of cool properties, but it does dampen the NLRP3 inflammasome. And it is found in cruciferous vegetables. So things like broccoli, Brussels sprouts, kale. It's really high in broccoli sprouts, so like the baby version of broccoli. And then finally, resveratrol, which you probably think of, red wine when you think of resveratrol. I'm advising clients, nutrition clients, to avoid alcohol right now, just because it may have some detrimental effects on the innate immune system. But you can also get resveratrol from grapes, berries, and then Japanese knotweed is an herb you can find it in. So I touched on this a second ago, but I just want to emphasize that a lot of this research is either preclinical or it's pre-peer reviewed. So, in the rush to get out information to researchers and doctors, a lot of these papers haven't gone through a complete kind of vetting process, but it's still interesting research. I included a picture here of a study looking at dietary molecules, potentially with benefits in COVID-19. And then another one on melatonin here, actually, which I thought was interesting. And last thing I wanted to touch on relates to melatonin. So some of this preclinical research suggests that melatonin can dampen the NLRP3 inflammasome activity. And something you can do dietarily that may help support your body's own production of melatonin is to practice time-restricted eating, or to simply just not eat too close to bed. The times of day during which you eat actually impact your circadian rhythm, and that's really closely tied to melatonin production. So I think if you're able to kind of eat within an 8 to 12 hour time frame each day, and then not eat for several hours before bed, that may help kind of entrain a healthier circadian rhythm and may have an impact on melatonin production. So you can just support your body that way as well. There's my references for you. That's all I have today.
Wonderful. That was very helpful. Thank you, Lindsay. So we're going to transition now to working with Valerie Keim and doing some mindfulness and stress reduction. And I hope that many of you feel the benefits of these exercises. I hope that you have been able to use them and to work with them on your own during the week. And these are for real. These are powerful medicine, in my opinion. And I want to just kind of put some numbers on that from what we learned last week. And we're going to do the same exercise today, where we have you give us a rating, basically, of your stress level prior and your heart rate, and then your stress level post and your heart rate. And what we showed last week, once we crunch those numbers, we should be able to do it more in real time this week and get you feedback today even. But last week as a group, when we did the EFT-based stress reduction, anxiety reducing exercises that Valerie led us on, as a group, we saw a 40% decrease in the perceived stress scale, right? So just on a scale of 1 to 10, how stressed do you feel? That went down by 40% as a group. And our heart rate as a group went down by 9%, right? So really nice physiological reset there. So again, we'll be doing that today, and we'll send out a link on the chat box, but actually, Valerie, maybe just a reworking of the workflow. Why don't we get those measurements right now? So just on a piece of paper next to you, I'll have you log them onto the chat later, onto the survey later, sorry, once we have the post measurements. But for right now, just get a piece of paper and a pen, and write, next to you, have it there next to you, and just give me a scale. I think about on a scale of 1 to 10, with 1 being no stress and 10 being severe stress. How stressed do you feel right now? And this is across any and all areas of your life. How stressed do you feel on a scale of 1 to 10? So write that one down. And then let's go ahead and measure our heart rate. So again, you can feel your pulse up here on your neck, if that's easy, or you can also use 2 or 3 fingers here on the thumb side of your wrist. You should be able to get a nice feeling of the heart rate there under your fingers. And that's basically, I'm going to time it for 30 seconds. So I'll tell you when to start counting. Your only job is to count those heartbeats. And I'll tell you when to stop, and then we'll calculate it from there. So, okay, go ahead and get ready and start counting. And stop. So write down that number that you got and multiply it by 2. And that gives us your heart rate in beats per minute. And that's our baseline. Okay, Valerie, I'll let you take it from here.
Oh, okay. Thank you so much for doing that. I look forward to seeing the results. And I'm going to do a couple of things today. Since I had such a positive feedback from the EFT, from the tapping technique, I'm very quickly going to show you one more all-purpose way to tap your way out of anxiety and stress. Just take a moment. It's super simple, and it has to do with locating the gamut spot. Now, the gamut spot is going to be, so you can see my fist here. It's between your pinky finger and your ring finger. So if you make a fist and locate the 2 knuckles that are connected to your pinky and your ring finger, then go right down from that knuckle, just below the knuckle, with these 2 fingers right there. That's called the gamut spot, G-A-M-U-T, and it's used in a lot of different sequences, but it works really well just by itself. So all you have to do is tap on it with these 2 fingers. That gets the spot, and it's that groove right between those 2 bones that lead to your pinky and your ring finger. Just feel into whatever your anxiety and stress is. Is it in your stomach, in your heart? Do you have a tight jaw? Do you just feel an overall tension? Doesn't really matter. Just tap, tap, tap about 50 times while you're feeling that energy. You might want to breathe into it to keep your focus. It's hard to keep a mental focus, but just tap. You're counting. You're noticing your stress while you count. You might notice that your stress keeps slipping away. Your thoughts get distracted, and bring it back. And that's it. That's all you need to do. And so try that. Next time you feel stressed or anxious or upset or worried while you're watching TV at night, just go ahead and try that and see what happens. It's also, of course, a great idea to give yourself a score before you do it, and then when you've finished, so you can see a measurable drop. Quite often, we just slide into feeling better, and we go, oh, well, okay, I don't know if that worked or not. But if you look back at how you were feeling just 50 taps prior, you'll get a big surprise. So that's the gamut spot, and please go ahead and enjoy it. And after that, what I want to talk about today is our unconscious mind and working with our unconscious mind in a very conscious way. there's large parts of our unconscious mind that do what we tell it to do. There's large parts of our unconscious mind that cannot discriminate between what we imagine, between our negative self-talk, between the messages we give it, and can't discriminate between that and what's actually going on in objective reality. And that's exactly how we work ourselves into worry, we lower our immune response, create insomnia, depression, and so forth. You know, right now our external issues are plenty enough to deal with. But what we tell ourselves, the messages we repeat in our head, the useless parts of worry, that sets us up for more complicated experiences of stress. This part of our runaway self-talk is unconscious, it's automatic, it's undisciplined. So today we're going to get our self-talk more focused, managed, and under our control. Why? So we can be in charge of the messages we're giving to our emotional and physical drivers of our health and well-being. So I'm going to talk about the placebo effect for a minute. You know, it's really interesting. It's 30 to 60% of people respond really well to that. It's got an efficacy rate of 15 to 70%. Clinical trials for new medications have to prove that placebo is not actually part of the test result. It's a problem in clinical trials. So placebo effect doesn't have to do with it being psychosomatic or having it all in your head. It's actually the body's healing response. It's the exact mechanism and driver of how our mind can influence our health in some pretty significant ways. And placebo is Latin for I shall please. So today we're going to bypass the need for placebo medications and work directly with that part of our brain that's always waiting, receptive, and eager to remind us that its strength and purpose is, I shall please. So if you can, get ready now. And by that, I mean, you know, put your feet on the floor. If you've got anything on your lap, put it back on the table so your lap is relaxed. Wiggle about, stretch, move so you feel more comfortable. And I invite you to do that at any point in the seminar, because the more you are comfortable and moving to make yourself so, the deeper you'll drop into a state of relaxation. You don't need to fight that. If you've got gum or mint in your mouth, now's a great time to take it out and double check your cell phone, make sure that you're not going to be interrupted. And what we're doing is from my, originally from my mentor, Marty Rossman, and his mentor, Naomi Raymond, from long, long ago. But it's an all-purpose, heavy-duty classic in terms of connecting your ability to influence your unconscious mind to influence your health and well-being. So if you're ready now, settle in. If you feel comfortable closing your eyes, please do. And if that's not comfortable for you, you're welcome to look down at your lap or your hands or some easy resting point that's not too distracting and too changing while we're doing this work. And start as ever by taking some slow, deep, diaphragmatic breaths. I want you to breathe in a sense of relaxation. Each breath a little more easy and steady than the one before. And breathe out feelings of discomfort. If you feel like it, pause between your in-breath and your out-breath. And release with every out-breath. Breathing in feelings of relaxation. And relaxing with each out-breath. Let go of tension with each breath. And whenever you want to relax more deeply, come back to this way of breathing. And now I invite you to invite every part of your body to relax. You may invite your toes, your feet, your ankles, the soles of your feet, the back part of your feet. You may even feel the balls of your feet and your heel. Simply mentally invite them to relax while you continue to breathe in relaxation and breathe out ease. Invite a softer way of being within your own body. Invite your calves, your shins, your knees to relax in their own way. Breathing in ease and comfort. Exhaling, releasing. Perhaps you notice your thigh bones, the big muscles in your legs. Invite them to relax. Your hip bones, your pelvic cradle. Breathing in ease and comfort, slowly and deeply. Exhaling, release of tension. Don't worry at all about how much you may need to relax. Just allow your breath to set the pace so you can relax deeply and comfortably and automatically. Every slow, steady breath through your belly, your chest, your lower back and upper back, your shoulder blades, relaxing in its own way without effort or struggle. You can feel your spinal column sinking even further into whatever is supporting it. And breathe into that as you sink back more into the cushions, just a little bit more as you release with every out-breath. And this sense of breathing and inviting your body to relax flows up into your scalp, the top of your skull, all the tiny muscle groups around your forehead and eyes, releasing with every out-breath. You feel the muscle groups throughout your jaw and temples. Just invite them, allow them, so that they too, in their own way, can let go into ease and peace. All the muscle groups around your mouth and throat, the back of your neck and shoulders are relaxing with every deep, easy breath you take in a way that's so easy and automatic, a completely comfortable experience. Imagine a very pleasant sense of relaxation flowing from your shoulders to your elbows, with every out-breath releasing, inhaling more relaxation and ease. So you notice your wrists, palms, right down to your fingertips, so that you've invited your entire body through your slow, easy breathing to feel very relaxed and pleasant, completely comfortable in its own way, automatically and effortlessly. Your mind sharp, alert, focused on my words and your breath, takes you even further as you imagine a beautiful place in your mind's eye. Let it be your favorite place. It could be a vacation spot you've always wanted to go to or wish you could go to right now. Or it could be a favorite childhood spot that fills you with joy and nostalgia. Or even curled up, safely tucked into your own pillows and blankets, your bed or sofa right now. Your mind's eye, just let yourself be there and enjoy that experience. Perhaps in your own way, you can notice what time of day it is as you take in all the dear familiar sights. Or perhaps as you're noticing the day, the time, You're absorbing the weather, which is just right for being in your favorite place. Whether you're indoors or out of doors, the weather is perfect for you right now. It's healing weather. You can feel it on your face and hair and skin, which allows your whole being to drop even further into an alert contentment while you take in all the scenery, the colors, in a way that's just right for you. Perhaps you can hear the dear, familiar sounds that are so wonderful, so familiar to this place. Will you take in that peaceful symphony? Perhaps you notice the scent, the fragrance that's unique to this, your favorite place. Your entire body letting go into the ease of your favorite place while you take in the sights and sounds and smells, the weather and the time in a way that's just right for you. And while you're enjoying that, going deeper and deeper, every breath you take, into contentment and an alert focus. Your mind so bright and sharp right now. You allow yourself to see an outcome about something that worries or concerns you. How would it turn out if it was entirely up to you, just like that, to change it? How would it turn out if you were in charge of it 100%? I want you to imagine how well it could go. I want you to see that right now. Not how you got there, but how you feel with this outcome, your positive, desired outcome. How wonderful that is. Feel the victory. Notice the relief in your mind's eye. And don't worry if it changes. Don't worry if your desired positive outcome has multiple images or scenes. It will keep evolving and sifting and sorting itself out. It's your unconscious mind cooperating with you already for it to solidify into one single image. That's the perfect outcome for you because you've been in charge and you've made it happen. And you can put energy into it. It's being so real and vivid. Put energy into it so it's exactly what you most desire. And if you need more energy, more vividness, invite in your loved ones to lend you their strength to energize this perfect result. And while you're at it, you can invite that which put you here, whether it's your higher power or God or the natural order of the universe. Allow that which put you here to lend you its strength. So this image of your exact outcome, the relief, the joy, the contentment, the victory, is vivid and strong. And know that while you're dwelling here for now, your unconscious mind understands what your conscious mind is telling it. Your unconscious mind is pleased to carry out this positive desire. Your unconscious mind wants to please you and cooperate. While you're looking at your perfect desired result, understand your unconscious mind loves your intention and knows that your intention is to activate all of your healing abilities. And isn't it wonderful that your unconscious mind knows exactly how to respond? While you take all of that in, knowing that this is so, I want you to come up with that one image has a phrase or a word attached to it. Maybe a caption or a label that best describes the essence of your desired outcome. And while you slowly breathe in that phrase or word, give it a hand movement. It could be your hand simply opening, like a gesture of peace. It could be a lyrical movement with your hand or fingers. Doesn't really matter what. But put a hand gesture to your phrase or word and your image. And this will always remind you of your choice, your focus, where you're putting your energy. This phrase and this hand gesture will instantly connect you even more to your positive image. So anytime you feel fears or worries, consider if the fear or worry is useful, if it's helpful. If not, simply summon the image, the phrase, and your hand gesture, and allow that to vanquish the worry. Let your hand gesture, image, and phrase fill your awareness. And notice how it feels to choose and to energize your preference. Notice it's a choice you can make to counter the worry, to bring your conscious mind to bear and be in charge. And let the feelings that go with your positive choice grow stronger with every breath you take. Now and with every breath you take. Know that this way of addressing the choice point between worry and victory is far better than the old way. Now take 3 slow, deep breaths. Once more, into your image, your phrase, your gesture. Just breathe into it. This is called anchoring. And you create a connection to something deep and powerful in your unconscious mind that you can bring back up to the surface with you. And in your breathing, just notice the relief, the happiness, the joy. And know that this automatically and effortlessly resets the trajectory for your choices. Now put that image somewhere into your body where it can do you the best good. And allow it to continue to build its healing energy with every breath you take. As you come back to this room, this time, this place, feeling good. And taking your time, whenever you're ready, you can open your eyes. Okay, so that concludes the deep dive into working directly with the placebo effect and bypassing the need for sugar pills. It's powerful and healing. So thank you for that. Yeah, Dr. Schwag, do you want to take a post measurement now?
Perfect. Yeah. Yep. I definitely felt my body resetting and my breathing resetting and my tightness in my stomach releasing a little bit. So again, everybody, go ahead and consider, where are you right now on a scale of 1 to 10, with 1 being no stress and 10 being extreme stress. Please pick a number and write down how you feel right now. And then again, measuring your heart rate, either here on your neck with 2 or 3 fingers, or here on your wrist on the thumb side, varying the pressure as needed to get a nice sensation of that pulse. And when you're ready, we'll just start counting. I'll set the timer for 30 seconds and I'll basically tell you to start counting and stop counting, just like before. So on your mark, get set, and start counting. And stop. So you should have 2 data points for before and 2 data points for after. Christy, if you can go ahead and please put into the chat box the link for the WUFU form. So there's a link there in the chat box. Everybody can see that. One question actually I have, Christy, is that you can't copy and paste from the chat box because of security features. So, and I'm not being able to click on that link. Then that's a little bit of a problem. So what we can do is, if
copy and paste, hold on.
I don't think it's allowing copy paste out of the chat box.
Can everybody go to our website where this is?
Yeah, so it's www.ccfmed.com. ccfmed.com. And there's also just a button at the top there for COVID resources. And then just down at the very bottom of the page, it says perceived stress and heart rate before and after Valerie Kimes. So somebody said it did work for them to click the link. For some reason on my end, it's not. Either way, however you get there, if you click that link, great. If not, on our webpage, ccfmed.com, COVID-19 resources down at the bottom, and there's that same link for that WUFU form. Click on that. Please enter your data. We'll give you just a minute to do that. Great. Thanks, everyone. So Valerie, you want to give us, we have a good group with us still. So let's go ahead and do the breakout rooms. And Valerie, just want to kind of give us any prompts or exercises to talk about in the breakout room sessions?
Yeah, I've got a couple. The reason we did this particular exercise was because it teaches you how to work directly with your unconscious. And it also keeps you, even though you had to temporarily suspend your disbelief about your desired outcome, it also trains your conscious and unconscious mind to work together to keep your eye on the prize. You know, if you're learning to play darts, You don't look at the outer rim, you look at the center of the bullseye, and then you throw. You know, if you're as I mentioned before, if you're a black diamond skier, you don't look at the rocks and the boulders and the cliffs. You look at exactly where you want your skis to go, and that's what you aim for. And learning to train our minds like that is incredibly valuable across the board, both for our own personal healing and well-being, and also for getting what we want from this life of ours. So when you're in the breakout rooms, talk about what it is. What is your bullseye? What is it that you want to see happen if you are in charge of things? So that's one prompt. And another prompt I'd love to hear people sharing about is, what is it about your favorite place that makes it so darn special? What are the traits, qualities, features of your favorite place that draw you back there? And finally, I'll leave you with this question. How can you replicate more of those same traits and qualities in your daily life if you're not able to get to your favorite place right now? That wasn't one. Maybe that's a bit of too much, but it gives you food for thought and discussion. So
That's great. Do you want to just review those one more time real briefly?
Yeah. One is, what makes your favorite place so special? How can you replicate those qualities in your daily life? And also, what's your bullseye? If you could be in charge of a troublesome situation for yourself or anything else, what's your target? What's your focus? If you were completely in charge of it.
I really like that one because I think for a lot of us, it's going to feel like something we haven't even considered, and like I didn't know I had any agency or control or power over this situation. But even going through the exercise helps me already think about ways I can take autonomy and control and some degree of self-action to help and protect myself and my family.
Yes, that's it exactly. It wakens our mind up to micro choices that we want to make deliberately and consciously, and not have our unconscious mind run amok with. Yeah, puts us back in charge of our choices.
Great.
That's it. Yeah, great.
So Christy, if you want to activate our breakout rooms, and look forward to seeing you guys over there, and then we'll wrap up together at the end. Great, welcome back everybody. So hope that was helpful, and we're going to keep doing these group webinars every week. Really getting a lot of really nice feedback from patients and from people on the webinar that this is really helpful, that this is something to look forward to each week, and it's really honor on our end on behalf of myself and all of our staff and clinic to be able to provide this space to just be together, to talk through, to provide information, to provide some exercises that we hope are helpful. These are all posted on our website. For the data gathering that we did today, we saw about a 33.8% decrease in perceived stress. So how stressed do I feel? So really, really nice reset, just on 10 or 15 minutes of visualization and breathing and mindfulness. So again, the science is there, this stuff works. So I always like to think about ways that we can learn to become mindful ninjas, to be aware and awake and paying attention, but not have that take a huge negative toll on immune activation, on sympathetic nervous system activation in our bodies. So learning to reset, learning to recognize the signs of stress, whether it's a tight chest or heart racing or tight face, neck, jaw, stomach. A lot of people hold stress on the front part of their bodies. Learning to recognize those signs and to make a choice. I'm going to do a little reset, and I'm going to drop my stress level down, drop my heart rate down. We saw about a 6.6% decrease of heart rate as a group. So basically heart rate as a total group went from 71.5 beats per minute down to 66.9. So a nice little physiological reset, really easy to access. And we look forward to seeing everybody again next week. In closing, we will post a survey for the overall webinar content and information on the website. Christy, I think we'll just do it that way. And before we wrap up, I just want to walk us through one more exercise. And there's been, my experience of this has, one of the real plus sides, one of the, moments that I've really appreciated is this sense of connection. And from prior to coronavirus to during and now, there's just this super immediate sense that I have that we are all on this planet together. We're all in this together. And, that's just the connection that I feel across countries, across borders, across socioeconomic groups. I feel like it's just a chance for us to recognize that we're all humans and we're all humans together. So in that light, I want us to do a little closing exercise. And if you just want to kind of sit up tall and maybe even put your hand on your chest, your heart area, and repeat after me and say, may I be safe and healthy. And may I be peaceful and at ease. May my family and friends be safe and healthy. May my family and friends be peaceful and at ease. And then broadening our view to the whole planet, and maybe even picturing looking down on the planet from outer space and seeing the entire Earth and imagining all the people on the planet. May everyone everywhere be safe and healthy. May everyone everywhere be peaceful and at ease. Wonderful. Thank you again, everybody, for being here. We look forward to seeing you again next week on Friday at 11 a.m. Pacific time. Take care.